So next I would like to call upon Dr. Santosh Agrawal to present about the Aurangabad region.
Good morning, everyone. At the outset, I thank Dr. Pramod Bende, Dr. Anand Vinekar, and iROP Society for giving me this opportunity. I dedicate this lecture to my beloved Chief Dr. Badrinath sir. AARAMBH, an innovative Tele-ROP project in the Aurangabad region, Marathwada region of Maharashtra. As you know, retinopathy of prematurity is a disease affecting the premature infants. The incidence in India is around 5 million babies premature every year. We have to screen those babies, and very few ROP experts are present, so the burden is very high. And very few of pediatricians refer the patients, so the apathy on the part of pediatrician, also awareness is very lacking in patients as well. Now, this is the old traditional gold standard BIO screening of babies, but there are limitations because you can skip the areas. It's a tedious procedure. You have to visit the NICU, and no proper documentation can be maintained. Now comes the wide field imaging for ROP screening by using wide angle fundus camera. We can train the optometrists for this purpose. It was developed and validated by KID ROP organization, Dr. Anand, under the guidance of Dr. Anand Vinekar. Australian report also substantiated this, and Government of India also accepted this modality. It's a wide field, portable, no financial interest. It's a Forus Neo camera, indigenous is Indian origin, made in Bangalore. On the left side, it's a RETCam, which is very hefty, but as against this 3 Netra Neo camera is very compact, very low cost, around 18 to 20 lakhs approximately, and sensitivity and specificity is also very high. It is we can take it to the rural areas, remote places, and mass screening is possible. It's an objective method, reproducible, and documentation is very well possible with this modality of imaging. Now, this is our model, Aurangabad model, AARAMBH ROP screening project. It's a partnership, joint venture. It's a team approach. 2 vitreoretinal specialists and 1 pediatric ophthalmologist. We have come together. We got inspired by Dr. Anand Vinekar and Dr. Sucheta Kulkarni. We trained ourselves. We got refined in various workshops and conferences. And we also met the neonatologist in our area. We visited different NICUs. We trained our optometrist at Narayan Netralaya, and proper documentation and systematic approach was applied. Good communication, coordination between patient, neonatologist and ROP expert was utilized. We utilized the multimedia and social media for this purpose. In one day, we follow one route, one city. Around 30 to 40 babies were screened in one day. Treatment is done at tertiary center or in NICU. For counseling purpose, we use posters, handbills, which are kept in the NICUs, and patients and relatives can be shown these images so that they can understand the disease very well. And we can utilize the local ophthalmologist as a collection center or for diagnosis and treatment if they are willing for that. This is our record file. This is our team, Dr. Hemant Anaspur and Dr. Ashish Solani along with me. And this is the report card for the patient. This is the leaflet. This is the poster we paste in the neonatology clinic. Very easy to carry. In the auto rickshaw also, we can carry this type of instrument. And this is a screening we are doing with the Forus Neo camera. Now, this is the interpretation at your own clinic. You can do it. You don't have to visit the NICU. Not only posterior segment, but anterior segment images also help you to determine the congenital anomalies like coloboma, RD, retinoblastoma, any albinotic fundus, and some posterior segment with we found some atypical cases, zone 1 APROP cases or 4A stage. This is a 4A stage. These are different. I won't go in the detail. APROP cases, zone half disease we could found. So before and after treatment, we could take the images. We can make a proper documentation. So I won't go in detail of everything. But this is the OCT we could take in few infants, and it's a retinal thinning we could found, and we can predict the visual potential. This is again APROP case. Avastin was given. So the zone half disease again. So Kid ROP program, HV Desai already running this project, and also Gujarat and many states are nowadays running. We are the unique in running this project as a joint venture in private, covering 8 districts of Maharashtra, and we're expanding. Some limitations are there. We need skill assistance, lot of traveling. There is apathy on the part of pediatricians. So around 10,500 babies we screened, and we treated around 345 babies so far. This is our data. I don't go in detail. This is unique model can be adopted not only in India but also across the world, especially in private sector, to curb the incidence of ROP and huge burden of childhood blindness. It's a low-cost indigenous camera. Tele-ROP screening and teamwork of experts can make it successful. You can very well maintain the documents for medical legal, for counseling, and for your data also. It's the ideal model to get adopted by many others. ROP expert ophthalmologist can work and monitor from his own clinic without visiting the NICU. Though it's not a profit-making project, but it imparts a huge social impact and fetch a lot of satisfaction to us. Thank you very much for your patient listening.